Hi, today I'll be reporting a case on oncology. A patient is presented with primary diagnosis of breast cancer. Reasons being, upon examination, there is a breast lump about 2 to 3 centimeters in size found in the upper left quadrant of the left breast. It is accompanied by edema, skin dimpling, and red discoloration. There is also enlargement of the left axillary and infraclavicular lymph nodes, and they are pain to the touch. Other signs include sweating during night and also weight loss. As for the plan of lab and instrumental diagnosis, we expect changes of decrease in white blood cell and red blood cell in the complete blood count, as well as a decrease in INR in hemostatic system, which means there is more tendency for blood to clot. And as for instrumental diagnosis, expected to see a breast lump about 2 to 3 centimeters in size upon ultrasound and mammogram of the breast. However, we do not expect any metastasis during plain chest x-ray. And the results of lab and instrumental diagnosis corresponds to the expected results. An additional biopsy of the breast lump is taken, and results show that they are poorly differentiated invasive growth of cells. As for the final diagnosis, it is breast cancer with a TNM classification of T2, N1, and N0. The plan of treatment for medical is tamoxifen, which is an anti-estrogen, and 10 milligrams of tablet twice per day, morning and night, for a week. Amlodipine, which is continued from a patient's own medication due to chronic hypertension, it is continued, and as well as ibuprofen, 800 milligrams per 4 hours for the pain, and surgical is opt. So for preoperative epicresis, I'm going to do a surgery on partial breastectomy of the left breast under general anesthesia. The indication for surgery is absolute. Risk of bleeding is moderate. Risk of thromboembolism is also moderate, and therefore the overall risk for surgery is moderate. There are no contraindications for surgery. Preoperative checklist, social data is confirmed, vital signs are checked and they are stable. There is re-examination of all systems and they are done without any new findings, and the area of surgery is clean and shaved. During intraoperative, aseptic technique is done, vital signs are monitored and they are stable. Surgery is done and it is successful. It took about 1 hour. For post-operative care, during the day 1, vital signs are stable. Patient is placed in a supine position without pillow due to obstruction of airway when the patient bends the neck on the pillow. Every 6 hours, the patient is given back rubs and position is changed to prevent bed ulcers. Patient is re-examined in 3 hours by attending doctor. During examination, local status is emphasized and change in local status is noted, and there is no additional complaints presented from patient. Pain is decreased due to use of ibuprofen, and dressings are changed twice per day. Dressings are soiled but without any discharge of pus and blood. Urine output of patient is normal without additional losses from vomiting or diarrhea. Diet of patient is kept on non-per-os (NPO) for the first day. The medical regime for the first day is heparin given every 4 hours, anticoagulant. Ibuprofen is continued for every 8 hours for pain. Patient's own medication of amlodipine is continued as well. As for day 2 post-operative care, vitals monitored are stable. Patient is now given a pillow for supine position at rest. Dressing are changed once compared to day 1. Dressings are not as soiled as yesterday. Wound on the incision wound of the surgical site is clean and without any complications of suturing. Foley catheter is removed. Diet is switched to clear liquid for the first half of the day, and second half of the day it is continued with full liquid diet. Medical regime is continued as of day 1. For day 3 post-operative, diet is switched to regular diet. Lab tests for hemostatic system, complete blood count, and urinalysis are ordered. Results are taken in 1 hour. Results of blood hemostasis system, INR is back to normal, 0.9. Urinalysis is without any complications of blood in the urine or stones, and it is normal. And complete blood count shows that increased back of RBC and white blood cell back to the normal level. IV line is removed. NG tube is also removed. And during post-operative care of day 4, there are also no surgical complications throughout these few days, and therefore a medical regime is continued for 1 week. And after 1 week, when patient is monitored for vital signs and re-examined again for final check, patient is presented without any complications and no complaints, patient may be discharged from the hospital and continue with the medical regime at home. Thank you.